This is Business and Economy, where we engage in analysis across critical sectors of the economy with a focus on implementation of economic policies of government. And today, we are into fiscal policy development. I am Ile Emeje. Nigeria aspires to lift all its citizens out of poverty by 2030 through its developmental policies, especially the fiscal arena. The overall objective of fiscal policy is to maintain the condition of full employment, economic stability, and to stabilize the rate of growth. For an emerging economy like Nigeria, the main purpose of fiscal policy is to accelerate the rate of capital formation and investment. Although the 2018-2019 Nigerian Living Standards Survey by the National Bureau of Statistics, NBS, provided the first official estimates of poverty in more than a decade, noting that accessing poverty trends in Nigeria is yet to be fully achieved and that there is a critical need for policies that can help to make growth work for Nigeria's poor. Macroeconomic reforms, including fiscal, trade, and exchange rate policy, could help diversify the economy, invigorate structural transformation, and create productive jobs, so to say, especially wage jobs that can offer the best pathways out of poverty. While some development experts say structural transformation and the creation of productive wage jobs on a large scale may not happen overnight, policies to boost the productivity of farm and non-farm household enterprises will be crucial in the meantime, even as the correlation between poverty and access to electricity, adequate drinking water, and improved sanitation is extremely high in Nigeria. On today's program, the Nigeria Country Director, One Campaign, an organization with a view on fiscal policy development, Mr. Stanley Achonu, is my guest, joining us after the business news to discuss the topic that says strengthening the pace of poverty reduction in Nigeria through fiscal policy. We'll be back shortly.
Equity sector of the Nigerian capital market transacted in a total volume of 988 million stocks last week, valued at 10.5 billion naira across 9,822 deals. During the last trading session, CWG, GlaxoSmithKline, and Cornerstone Insurance were top on the advancers with a gain of 9.96%, 9.82%, and 9.78%. However, Enamelware and Veritus Capital led the decliners with a loss of 10% each, followed by Prestige Assurance, surging with 9.80%. In volume terms, the banking subsector dominated the general activity level with 486 million stocks, while the insurance index and the consumer goods industry contributed in 86 million stocks and 66 million stocks in that order. Meanwhile, the Naira sells on the investor and exporters window for 770 Naira to the dollar, 968 Naira to the pound sterling, and 851 Naira to the euro. Ile Emeje, ASO Television News.
Our guest, the Nigerian Country Director of the One Campaign, Mr. Stanley Achonu, is already in our studio to look at the topic, strengthening the pace of poverty reduction in Nigeria through fiscal policy. Mr. Achonu, you are welcome to the program.
Thank you for having me.
All right. As we are all aware, poverty reduction is critical to any country of the world, including Nigeria. And this is mostly achieved through collaboration with relevant stakeholders as yours, the One Campaign. Okay, tell us now in practical terms what your organization, the One Campaign, is all about and how you have been able to end or to support the drive to ending poverty reduction in the world.
One Campaign is a global movement of people. We have about 9 million members around the world. It was founded by Bono and a couple of artists, activists from around the world. Our work is mainly focused on ending extreme poverty and preventing communicable diseases. One practical example of the work we've done in this regard on a global scale is Bono led the campaign for debt relief for extremely poor countries in the late 90s and early 2000s when Nigeria benefited from the debt relief. It was part of that global campaign to get the international lenders, IMF, World Bank, and the rich countries to forgive debt for poorer countries. The argument then was that poorer countries were spending a lot of money servicing the money they have borrowed, thereby limiting their ability to invest in critical sectors that lift people out of poverty. So we recognize that debt was a big issue for limiting countries from lifting people out of poverty. So we aggressively asked the world leaders to act on that. From world capitals in DC to London to Paris to Berlin. Our co-founder and the activists that joined in founding the organization back then, who held global concerts, mobilized citizens around this issue until poor countries got relief from debt. We also recognize that poor health outcomes are also very crucial to lifting people out of poverty. So we launched a sister organization called RED. We raised money to fund preventable diseases, to elimination of preventable diseases. We are the second biggest donor in the world outside of government to Global Fund to eliminate tuberculosis, malaria, HIV and AIDS, and other preventable diseases. Here in Nigeria, Global Fund is a major player in immunization, vaccination, and all of the rest. Also the critical funder for preventable diseases like HIV and AIDS, malaria programs, and tuberculosis. So a lot of the vaccines and medicines for these diseases in Nigeria come from Global Fund, to which we contribute the second largest fund, private sector fund, through our sister organization. And we have been in Nigeria for a while, and we have done work. Aside from the work we've done globally, we have also done work here in Nigeria. In 2016, we launched the Make Naija Stronger campaign.
What is it all about?
It was focused on health, because if Nigerians are stronger and healthy, they will be productive. So and health is a critical component to lifting people out of poverty. The extreme poor, give them access to free health. They become more productive, right? So we launched the Make Naija Stronger campaign in 2016, aimed at primary health care. Because it's not tertiary, it's not secondary. Your tertiary and secondary healthcare, your general hospitals, your teaching hospitals are not where the poor people access health. The poor people access health at the primary healthcare centers, right? And we thought that if you strengthen our primary healthcare, our PHCs in our wards, in our villages, in our communities, you then create a healthy Nigeria. So that's why we thought that we aptly named the campaign Make Naija Stronger. And one of the first critical things we wanted to do was to get Nigerian government to sort of implement the law that was already passed. The Nigerian Health Act was passed. In that Health Act, it provided for funding of the basic healthcare provision fund.
Primary healthcare.
Yes. So it was for primary healthcare, and the government at that time was not implementing that aspect of the Nigerian Health Act. So we campaigned under the Make Naija Stronger campaign for that to happen. In 2018, for the first time, President Buhari provided for 1% of the consolidated revenue fund to go to primary healthcare, and today that fund is active and functional. And a lot of primary healthcare centers are receiving that grant around the country. And we worked with a coalition of civil society organizations here in Nigeria. So we do, we have been strong advocates for health. We also contribute to education. At a global level, we raise funding for Global Partnership for Education, which looks at primary education and innovative ways of delivering primary education. So our work is focused on ending extreme poverty, but in a systematic, policy-driven way and in a collaborative manner with government, because the bulk of the foundation for lifting people out of poverty will come from government, while we recognize that things about the job opportunities, the economic opportunities that come with lifting people out of poverty can be driven by private sector. government lays the foundation for private sector growth that then creates that opportunity. So we are very systematic. We are policy driven as well.
Okay, when you talk about the primary health care and then primary education, you know that these are the closest to the people at the grassroots. In what way do you think that your program has impacted the Nigerian economy in this ramification?
And I like the fact that everyone recognizes that the primary education, primary health are the closest to the extreme poor.
Yes.
They are not people that are based in cities like Abuja and Lagos and Port Harcourt and Kano, right? In most cases, the people who access this primary education, primary health care are people in the rural areas who constitute the bulk of the rural poor and the extreme poor that we have in Nigeria. So we're very clear about that, right? In terms of what our contributions are, and I've given you an example of the primary health care work that we have done. With that funding right now, a lot of people are now covered under the basic health, under the health insurance provided by the states through the funding from the Basic Healthcare Provision Fund. Even though that has been very slow, but there are people now covered under that program. There are people now that are able to access primary health care in their community due to the impact of the Basic Healthcare Provision Fund. Also, I talked about the work we do to raise funding for Global Fund to provide immunization for newborn, for HIV and AIDS, for tuberculosis. A lot of the malaria drugs are available in the primary healthcare centers in the rural areas, and all of those preventable diseases come through the Global Fund, to which we are the second highest contributor. And Nigeria is a huge beneficiary. The last check, the Global Fund was providing almost $4 billion over a 5-year period to Nigeria alone to tackle primary healthcare and preventable diseases. So our work is extensive, and the numbers are there. But again, we are more focused on doing more rather than talking about beating our chest and saying this is the progress we have made. We are more focused on saying there is still more work to be done. As long as there are extreme poor people in Nigeria, anywhere in the world, our work is not finished, and we'll continue to explore ways to continue to partner with government in this regard.
If you ask a lot of Nigerians, they have raised a lot of concern on the bills that they encounter at the hospitals, and which the primary health care are inclusive, especially those at the rural area. Now, you have said that your organization, through a partnership with other international organizations and the government, has spent over $4 billion. Is it $4 billion? $4 billion.
Global Fund is delivering $4 billion over the next 5 years. $4 billion
to Nigeria alone. How come? If these support are well implemented, as you are saying, how come there's this serious complaint by many people, the sick ones visiting hospitals, including the primary health care, on inaccessibility to get some basic treatment? For example, if you get to any primary health care, you pay for almost everything, even for as low as Panadol. How come? Why do we still have that?
It's still a challenge. Again, it might sound like that is a lot of money, but you also have to recognize that the size of the problem, right?
Okay.
The survey you referred to says that there are 133 million Nigerians that are in poverty, that are multidimensionally poor, either in terms of access to health, education, or opportunity, depending on where they fall into. 133 million of that. The challenge with our health system is enormous, so we must recognize that, right? We have very limited funding. Global Fund is only complementary. There's also the budgetary provision from the Nigerian government, right? But as much as government and partners are working hard, the challenge is enormous, and we can only ask for more to be done. But I would say that remember that these are early stages of this process, and we're also in a learning environment. While government is now increasingly bringing more Nigerians into the insurance coverage through the universal health coverage that Nigeria government is implementing, it's still a big challenge. Drug availability of doctors and nurses and midwives and all of the healthcare workforce is still not there. But it is recognized that Nigeria has one of the highest out-of-pocket expense when it comes to health. Nigerians pay one of the highest amounts in the world. It's still extremely expensive, even for those that are covered under the health insurance, right? It's still very expensive because there is just a limit to what the insurance can cover. In fact, at the last check, some of the insurance was providing about 500 naira per individual, right? Which that can't even buy malaria medicine for anyone if your insurance coverage is 500 naira on a monthly basis. So there's an enormous gap that needs to be filled. But we think that a lot of times we focus on only the problem without looking at the progress that has been made. Of course, like I said, there's enormous challenge, but progress has been made. Before now, people were not covered under the health insurance. They couldn't even walk into the hospital except you're able to pay for card. Before you are then attended to say, oh, let's understand what the problem is, and then you get a prescription, right? So we must recognize the progress that has been made. If only the health insurance is even only able to allow you see a doctor or a nurse, right? And so that you can even understand what the problem is and know what sort of medication that you buy is one challenge we have overcome, right? So, but there's room for improvement. And this is why, for one, we're advocating that under the palliative programs that government is putting in place with this subsidy removal, that we should increase health insurance coverage. Rather than paying out cash, we can make it conditional cash transfer. Conditional on the fact that you get health insurance, right? So for those that are going to benefit from this program of your palliative, please make it as a condition that they also get health insurance coverage. It's cheaper, right? It doesn't completely eliminate the cost, but it lowers the cost. For some people, they refuse to go to the hospital just because they can't afford to pay the cost of consulting a doctor alone, not to talk of buying drugs. So we recognize that the challenge is enormous, but there's still room for us to continue to improve. And the progress that has been made needs to be recognized. It's been slow. Almost 10 million people are now covered under the universal health coverage being provided through the Basic Healthcare Provision Fund. That's progress. It's been slow. Over a 10-year period, it's been slow. We can ramp up that effort very quickly, but we must also recognize that government is actually investing and making that effort. Okay,
now that we are in a season where all of us in Nigeria are waiting for the ministerial nominees to assume power. Very soon, ministers are going to be posted to their respective jurisdiction. What do you think the incoming Minister of Health should adhere to? What should he focus on? Maybe 3 top areas or issues you think he can focus on to bring or to ameliorate these challenges that you have just enumerated.
And I'm happy for the choice, the suspected choice of minister. If the person who we think will become the health minister is who eventually gets that position, then we're in good hands, and we hope to see some tremendous progress. But he's one of the experts, best hand in the world on public health. So we expect that he understands the problem. But I think that I can only hazard a few ideas of where I think attention needs to be paid.
Like?
I think that health financing will be very crucial. Money is extremely important for quality health care. Whether it's a primary, secondary, or tertiary, money is extremely important. Luckily, the president has committed to at least 10% funding of the entire budget will go to health. If that is made possible with the strong leadership of the health minister, we expect to see some progress. And it's not just a one-off commitment. I hope it is a sustained commitment of a minimum of 10% of the budget going to health over the next 4 years. A lot of times, those investments, you don't see the result immediately. The result might start to show in another 5-6 years after you have left office. It's not always a direct impact, but I hope that they stay true to this commitment. That's one area I expect the minister to pay attention. The other area, which is something we've talked about, is access and equity, right? We need to make health more accessible to people, as I mentioned, and as we discussed.
Especially at the grassroots.
Especially at the grassroots. There are people who just for the sake of consultancy fee refuse to go to hospital. We need to make health more accessible to those people. So a lot of investment, an effort should go towards reducing out-of-pocket expense that extreme poor people commit to health. For a lot of people, buying malaria medicine of 1,000, 2,000 naira might mean nothing. But there are people that will not, that would be life-threatening, right? So we need to make sure that we reduce out-of-pocket expense. And that's one area I hope the new minister will pay a bit of attention. One other area is the health insurance we talked about. It delivers value, right? Health insurance delivers value. It has, people do not trust insurance in this part of the world, but health insurance do deliver value. And I hope that the health minister will continue to pay attention. One last thing I hope the minister takes very seriously is workforce, health workforce. We're facing a massive brain drain, and honestly, we can't blame the doctors for leaving. The work condition is terrible. The environment which they work in, the remuneration is poor. We saw the incident in Lagos recently. I hope that a concerted effort and policy is driven towards taking care of our health workers. Their complaints are valid. If you work in the kind of conditions under which they work, with the enormous pressure and the number of people they see on a daily basis, you understand that we need to do more to encourage our health workers, especially with remuneration and the environment in which they work on, equipment, materials, and all of those things. We need to do more to encourage our health workers.
Okay. When we look at collaboration, we always assume that effective collaboration with relevant bodies like maybe yours, civil society, government partnership with other bodies, international and local, is expected to yield better results. Now that you are into collaboration with the government, what can you say are the main results, your achievements so far in Nigeria?
We've been talking extensively around health, and I think that our work in the health sector, helping to get the basic healthcare provision fund functional, is one area where we can beat our chest and say we've made progress. But there's one little known effort of our work that I guess time has made us forget. Is debt cancellation. Debt cancellation in the early 2000s, when President Obasanjo was head of state, Nigeria received extensive debt cancellation.
Then Minister of Finance.
So Kunjewala was finance minister. That effort did not, it took concerted effort, a collaboration between governments of most of these low-income countries and the work we did then on the debt cancellation, right? Campaigning around the world. And Nigeria was one of the beneficiaries. Several other countries benefited from that debt cancellation, getting IMF and World Bank to sort of cancel some of these burdensome debts that we were facing. And I think we are back there again, because a lot of the low-income countries are now facing huge debts.
Debt burden.
Nigeria is one example, and we are also back to asking World Bank, IMF, and those international creditor partners to also do something about the cost of borrowing for low-income countries.
Okay. Now that you have done a lot in the past, going forward, what are your plans for maybe if they can give us another debt burden, given the economic situation globally and that of Nigeria?
At the moment, we are hard at work on this issue because we have been studying the debt trend around the world, and also specifically here in Nigeria, where we work. Colleagues also in the various countries we're working and looking at the situation in their own countries. The world is ripe for that conversation. And this time around, we're not just asking that debts be cancelled, because we have now sort of learned a few lessons from our previous campaign. One of the key issues we have now recognized, which is now gaining global attention, is that the cost of borrowing for poor countries is extremely high. And that cost is what drives, not the borrowing itself, but it's the cost of the borrowing. The interest rate, when I talk about cost, I'm talking about the interest rate. The cost of borrowing for low-income countries is very exorbitant. While loans from World Bank and IMF will come at 1%, 2% interest rate, when you go to the Eurobond and all of those open markets to borrow, which is where a lot of countries go to borrow now, the cost is quite high. For countries like Nigeria, in 2021, we spent 91% of our revenue on debt servicing, which is a huge cost. When you compare how much we earned and how much it costs to service our loans, it then means that we're not able to invest in critical areas that we have talked about, like health, education, job opportunities for young people. So we are very systematic. We're asking the World Bank, which has more concessionary loans to give to countries versus the Euro bonds and all of those other bonds that government assess, which are very high. We are saying the World Bank needs to expand their ability to give loans to countries because that is a cheaper loan to borrow. When you go to Euro bonds, the interest rates will go from 7, 8, 9%, as high as 16, 17% for some categories of borrowing. But when you go to IMF and World Bank, it's 1%, which is cheaper and has longer term repayment terms. So we're not very systematic in saying free the fund and fund the future. That is one of the areas we're not saying fund the future. We're asking the world leaders. The World Bank president was here a few days ago, and we issued out a press statement calling on him to free up the funds. World Bank sits on trillions of dollars that they are not investing. Why there is need in countries like Nigeria and all those other poor and low-income countries. So we're asking them to free up the funds so that Nigeria can get more funding from World Bank versus going to the Euro market to borrow from the open private sector-led funding. Those ones are not exactly very cheap. So we're hard at work at that. We're also asking at the moment for a reform of the global financial architecture, and this is something that we're very passionate about. And I'll give you an example. When Nigeria borrows from the open market, and US changes their interest rates, if the US Federal Reserve Bank announces interest rate changes, it automatically has direct impact on any money that Nigeria has borrowed from the Euro market because the interest rates on those borrowings will also increase.
Yes, it will go.
So we're saying that we need to reform the financial architecture, the global financial architecture, so that when US makes internal decisions about their own economy, it should not directly have impact on Nigeria economy unknowingly, because what it has meant now is that once US announces interest rate changes, if it goes up, our interest rate goes up, right? So we need to sort of build a new global financial architecture so that our own local decision does not affect America. Why should America's local decision affect Nigeria? So we need to find a way to delink and build a new global financial architecture. And this is a campaign that we are currently pursuing. G20 is already set up a committee to look into that. Hopefully it will form a key topic of discussion for the next G7 meeting as well. World Bank, IMF are all being pressured to go along with a reform to global financial architecture as well. Okay,
now that we are looking at the IMF and World Bank, international bodies that are assisting Nigeria in the area of loan and other things, I also want to ask about the concern raised by a lot of Nigerians saying that the World Bank, the IMF, that is our creditors, are always giving stringent conditions being attached to the loans offered to Nigeria. I want to hear your reaction, but before then again, you know that experts and international organizations like IMF and World Bank have lauded Nigeria's subsidy removal, subsidy cut, and its currency floating without considering the resultant impact on Nigerians. What measures do you think should have been put in place because of the effect?
So on the first part of your
the concerns raised by some Nigerians that stringent measures are always attached to our loans.
On that part, the creditors will always have their way, but that's on the lighter side. But a lot of times we talk about the conditions, but we don't specifically mention what are these conditions that are attached to these loans. That part is we're always very silent about it, and it tends to sound like the conditions are entirely negative. They are not always negative. Some of them might not be palatable to us. They might not be things we expect, but they are not always negative. And I say this because I remember there was a certain time when condition was attached to some World Bank loan, and the conditions were that you publish audit reports, you audit the account. That can be negative, right? But we always talk about these conditions without saying what exactly are the conditions.
Sorry to cut you short.
So we are stuck with the SAP era. So
yes. The SAP era and now the subsidy removal.
Yes.
A lot of people have the belief that it is one of the conditions of the World Bank or IMF attached to the loans or the debt burden in order to retrieve, at least to be able to get back the loan.
To be honest, yes, the World Bank, IMF have been advocating for things like floating the currency and removing the subsidy.
Those are some of the concerns raised by Nigerians.
But the decision to remove it is solely a Nigerian decision. The Nigerian government made that decision. And if anybody paid any attention during the presidential campaign, all of the candidates agreed that we must remove subsidy. All of the candidates agreed that the currency, the way we have managed our foreign currency, wasn't good. So it wasn't about IMF and World Bank anymore. It's about our economic reality. Our economic reality clearly showed that the government couldn't afford to continue to bear the burden. It's no longer. IMF have been advocating for subsidy removal for almost 20, 30 years, right? It didn't take them this moment when we have done it. It has not come under any IMF or World Bank pressure. It has come from reality now setting in that we can no longer afford it, right? We're spending way too much. There are beneficial sides of the subsidy, especially for the country, in the country where we live in, where we have to literally pay out of pocket to provide electricity for ourselves. When you remove the subsidy, it just does not only affect cost of transport, it has direct impact on production. But it's not sustainable. If we are going to have the resources we need to invest in things like energy, infrastructure, health, education, then we need to let some things go. So, think about it this way. We have accepted subsidy in lieu for infrastructure, in lieu for education, in lieu for health, right? So now it's a conscious decision that government is making to say, look, we have to let subsidy go so that we can then have the resources we need to invest in those critical sectors. The impacts are enormous. I feel it, you feel it, everybody feel it. It's not an easy decision, but government is not just set up to make easy decisions. From time to time, government will make very hard decisions, and this is one of those very hard decisions that we have had to make. For me, I think that what we need to focus on is what do we do with this change that has happened, and how do we make the most out of it? For me, I have things, my own expectation of what I think that government should be doing, and one of them is what are we investing the subsidy saving? Because remember, before we were investing the money in subsidy and infrastructure and things, we are suffering. Now that we have saying we are no longer investing in subsidy, where do you then want to channel the money? And I think that a bit of accountability and openness on the part of government will be very crucial in building trust, right? Trust is really very, very big at this point.
It's like an asset.
It's an asset that government cannot afford to take for granted. And I think that there are a few things that government needs to do. They have taken the right step to remove the subsidy, but they've also disappointingly failed to show Nigerians that they feel the pain that the citizens are feeling. And I expect to see government take conscious effort to reduce cost of governance and free up resources that then goes towards infrastructure. But there is also need for them to aggressively invest. You have to now show evidence of where the money is going to. That's one process of building trust. Accountability, openness play key role. Once Nigerians are in the know and they go along with you in your programming, it will be more palatable to say, oh, go through this short period. That's one area. So I expect that the cost of this burden shouldn't be borne by Nigerians. We must see those in government show effort that they are in this with us by also cutting costs. If I tighten my belt, I expect those in government to tighten their belt. So a lot of waste within government needs to go. But we also need to directly invest in pro-poor policies, put money behind policies that lift people out of poverty. We have spent too much time debating palliatives without actually getting to work. We need to get to work to deliver palliatives that solve problems, right? I hope that this delay in rolling out the palliative means that government is coming up with something really comprehensive that will deliver value for Nigerians. This is my own expectation. So we need to make sure that the subsidy savings work for Nigerians. That's one way. That's one way we can rebuild trust and get Nigerians to go along. And I hope that government is consciously doing that. I've seen some positive. The commitment to invest 10% of the budget to health is a positive step. That would be almost doubling the amount of money we spent on health last year, and that would be tremendous improvement in things that affect the poor. And I hope we can channel similar resources to education as well.
Okay, although we are all aware that the government has been on an enlightenment program asking Nigerians to bear with them in this little time of the effect, going through the effect of the fuel subsidy removal. But the argument by many Nigerians is that in other climes, where subsidies are removed in one sector or the other, some measures were always put in place. So now, what measures do you, going forward at this point in time, what measures do you think the government should put in place to cushioning the impact of this fuel subsidy removal?
Well, and I know that the government experts are hard at work. There's been conversation around transport, transportation, you know, and then also cash transfer, you know, direct cash payment to the extreme poor. But I also think that government needs to take a holistic approach. I guess, you know, for me personally, I think that some government should have, you know, given this process a bit of thought. They should have, you know, sort of been a bit more comprehensive in their approach. But we are here now, so I think that a few things need to happen very quickly. One of the things that needs to happen very quickly is the conversation that is already ongoing in, you know, sort of energy-saving means of transportation. The gas-powered buses that government is hoping to deploy over the next few months. Electric vehicle, yes, that needs to happen very quickly. Not just only in the urban areas where, you know, cost of transport has considerably risen, but we also have to consider not just transporting humans, but also transporting food and produce, right? That has had direct impact on households.
Across states of the Federation.
This is not just an urban problem. This is everywhere. The ability to move food from farms to household has also increased. That has also driven the cost of food up. So there has to be some way you know, to bring in the agricultural component of this. So not just only on the transport, but also on the cost of food. Government needs to do something very quickly. One other area I think that government needs to invest very quickly in, and I talked about it, is the conditional cash transfer. The plan is to roll out conditional cash transfer to 12 million households, right? We currently have 10 million people covered under the health insurance. If we add health insurance to the conditional cash transfer, to say as condition for getting this cash, go and register for health insurance, it automatically takes the numbers up to 24 million. 24 million people, 22 million people covered under the health insurance will be a big boost for our health sector. Remember, it's a contributory process. It also delivers money to the health sector. So I think that we need to do that very quickly. That is not something you need to reinvent. It's just simply a condition to say, before I pay you this 8,000 naira on a monthly basis, you should go get signed up for health insurance. We can do that for education. The reason I advocate for these things is because they have long-term impact. It's not, and like I said, the results will be felt in 6, 7, 8 years
to come.
Not immediately. And nobody lifts people out of poverty in a fell swoop. It's always a long process. It's always a lengthy process. You invest today, it grows and germinates, and then the results come out. The fruits, it bears fruit eventually. And I think that government needs to take not just a short-term view, because there's that pressure on them to respond very quickly. But in responding very quickly, you have to also have a long-term view to it. It shouldn't be only the things that are politically expedient at the moment, but also things that are long-lasting in the long run, are the things that government should invest in. So I would advocate for investment in health, investment in education, and of course the agricultural sector, you know, supporting transportation of goods and services from farm to homes, you know, any way to drive down the cost. Maybe some tax incentive can be introduced. You know, some have advocated that if you have removed subsidy, then maybe it's about time to cut tax on petroleum products, diesel fuel, get rid of all of the taxes that are associated with it. That might help cool down the rising cost that we have seen in the last 2 months.
Okay, as laudable as these initiatives or the palliatives may seem, the question to ask is the problem of how are we sure that this initiative, especially the cash transfer, the direct cash transfer, will get to the vulnerable, the people that these monies are meant for?
Of course, we at the first National Economic Council meeting, the governors came out, in quote, gun blazing about their thoughts on the National Social Safety Register.
Yeah.
I think that there is valid concern about if the money is actually getting to the true poor, and if it is not being stolen. Trust is something that for people to trust you, you have to earn it, right? And you have to actively go out of your way to earn people's trust. There is a lot of doubt about the validity of the national program. I've spoken to those who are very closely involved in the process, and they think that they have taken every possible measure to mitigate against fraud in the process, which is one doubt that Nigerians have. They have made sure that the register is reflective of the true poor and vulnerable in the society. But I think that they have done a poor job about communicating and convincing Nigerians about the validity of this register. Those inside think that it is a valid register. Those outside think it is not, as we saw from the National Economic Council. And I have a few ideas of what I think government can do to reassure Nigerians. One of the things I would advocate for government to do very quickly is an extensive audit process of the existing register to verify the validity of those who are in the register.
Okay.
There is also poor communication that we have seen from government. And one of the key questions is, how are you delivering this money, right? Some are being done through electronic transfer, through cash wallet and all of that. It sounds very vague to a lot of Nigerians. So a bit more of openness about how this process works.
Monitoring and supervision will just help.
And a bit more improving on the communication of this process, because I know a few of those who are involved in this work, and I've seen the effort they have put into it. But then this doubt, this cloud hovering over the transparency and openness or the corruption assumptions around it, right? And does not do justice to the work they have done. So I think that it comes down to them not taking into consideration that you need to build trust of citizens. And I hope that one of the key lessons to be learned is that you can do good work and you communicate wrongly, and it will then sort of disrupt the effort you have made. I think they need to do better with communication. They need to do better with openness as well. And I hope that the government will actively take that step. They need to show Nigerians that their register is open and transparent, and that it is getting to the real beneficiaries, and that they are taking the issues of fraud and corruption in the process very seriously. Where that is dictated, they need to openly deal with those involved. That way you build trust of Nigerians.
Okay, Stanley, time will not allow us to finish all the issues and the areas we want to discuss, and we will want you to come back again on the part 2 of this program. But as we are rounding up, you recently launched a program that you titled Navigating Nigeria's Debt Burden While Protecting Social Spending. Can you tell us how this will impact low-income households and small businesses as we round off?
It's broadly what we have discussed. What we looked at was the cost of borrowing and the cost of debt servicing in Nigeria. And we were trying to see what is the direct correlation between that and our ability to meet the needs of households, low-income families. So that report looks at the cost of our debt servicing and how it is directly impacting investment in health, education, job opportunities, and infrastructure. And we were advocating for how government can mitigate it. Things like low-income borrowing, sort of finding cheaper means of borrowing, refinancing existing debts, and what government can do with other global partners to make sure that we ease our debt burden and free up space for investment in real sectors. All right. If you have the opportunity to meet with President Tinubu, what would be your advice? I will focus on Nigeria's debt crisis at the moment, and I will ask him to join other world leaders to advocate for changes to the global financial architecture. It has direct impact. It will deliver value, and it will help free up resources for him to then invest in real sectors. And I will ask him to strongly be a global voice in that campaign.
All right. The president should be a global voice in that campaign, according to Mr. Stanley Achonu. And that is the size of our package on today's edition of Business and Economy. I believe we have learned a lot, especially on the drive to reducing poverty in the country through government reforms and partnership. The analyst has been the Nigerian country director of the One Campaign, Mr. Stanley Achonu, a stakeholder in fiscal policy development. Mr. Achonu, we want to thank you very much, and we hope that if we invite you again for the part 2, you will honor our invitation.
I'll be here. Thank you for having me.
Oh, thank you. And to you out there, our esteemed audience, we appreciate your time with us on the program today. Enjoy the rest of our programming.